Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. For those who don't know me, I lead advocacy and policy here at GHLF. I'm a lawyer by training, a policy professional, and also someone living the system beside you. My job every day is to take what's happening in Washington and translate it into what it actually means for patients. And sometimes what it means isn't always obvious until it's already affecting you. Before we get into it, I want to ground this in something real. Recently, I heard from a parent in our community. She told me, "I don't know what to believe anymore. One doctor says one thing, the news says another, and now I'm not even sure what the government recommends." That's what today is about. Because when it comes to vaccines right now, something is shifting. It's not just policy, it's not just messaging, but trust. And when trust starts to erode in public health, patients feel it immediately. So today, we're going to start to connect the dots. What's happening at the FDA? What's happening with vaccine recommendations specifically? Why confidence in vaccines is dropping? And what this all means for you when you sit down with your doctor. Let's start with the FDA. Last week, the FDA made a surprising move. It refused to review a new flu vaccine from Moderna. Now, this is important. The FDA did not just reject the vaccine outright. It declined to review the application as submitted. Here's why this matters. The vaccine uses mRNA technology, the same platform used in Moderna's COVID vaccines, and the disagreement centers on how Moderna designed its trials, specifically which existing flu vaccine it used as a comparison. That may sound technical, and it is, but zoom out for a moment. This is happening in a broader environment where vaccines are receiving more scrutiny than they have in the past. And for patients, the takeaway is not about trial design, it's about uncertainty. When people hear that a vaccine isn't even being reviewed, it raises questions. Is something wrong with the vaccine? Is the process changing? Are vaccines being treated differently? Even if the answer is simply a scientific disagreement, the perception matters because perception shapes trust. Now let's talk about the trust directly. New data shows that confidence in vaccines is slipping. We're still talking about majorities, overwhelming majorities in fact, of people who still believe that vaccines are safe. But the trend is moving in the wrong direction. Confidence in flu vaccines is down. Confidence in the MMR vaccine is down. Confidence in COVID vaccines remains lower than all of the others. And this is happening during a measles outbreak, during a very recent difficult flu season, and during other ongoing public health challenges. So what's driving this? It's not just misinformation, it's mixed signals. When recommendations change, when agencies appear inconsistent, when scientific processes feel less clear, people don't necessarily reject vaccines, they hesitate. That brings us to one of the most important shifts happening right now, the move towards something called shared clinical decision-making. In simple terms, this means certain vaccines are no longer strongly recommended across the board. Instead, they are something you discuss with your doctor and decide together. On paper, that sounds quite reasonable. More choice, more conversation, more personalization. But here's the challenge. When a vaccine moves from strongly recommended to something optional, it changes how people interpret it. Doctors may feel less confident in recommending it, patients may interpret it as less important, and overall, the signal becomes weaker. This is exactly what many public health experts are worried about, because in population health, clarity matters. Strong recommendations lead to strong uptake. Uncertainty leads to hesitation. And now this is moving into the courts. The American Academy of Pediatrics has challenged recent changes to vaccine policy. And they are not alone. More than 100 public health organizations and experts have stepped in to support that challenge. Their concern is straightforward. They believe changes to vaccine recommendations are weakening a system that has protected patients for decades. The argument is not just about policy outcomes. It's about process. For years, vaccine recommendations followed a structured, evidence-based approach. When that process changes or appears to change, it raises concerns about consistency and credibility. And again, for patients, this shows up as confusion. Who should I trust? What is actually recommended? What is optional? Those are real questions people are asking right now. If any part of this is hitting close to home, raise your hand. Go to www.ghlf.org and sign up for our newsletter. We break this down in plain language and tell you exactly what's changing and what to watch for. You don't need to follow a policy every day. That's our job. But you should know when it's affecting you. Okay, let's take a step back. Because all of these stories, FDA decisions, changing recommendations, legal challenges, point to something bigger. We're in a moment where the system that guides vaccine policy is shifting. Not collapsing, not disappearing, but changing. And when systems change, there is always a period of instability. For patients, that could mean more questions, that could mean less clarity, that could mean more reliance upon individual clinicians. And that last point is very important because as federal guidance becomes less definitive, more responsibility shifts to the doctor-patient relationship. These doctors are often overburdened as is. So what should you take away from all of this? First, vaccines themselves have not suddenly changed. The science behind them, especially for long-established vaccines, remains quite strong. Second, it's the environment around the vaccines that is changing, and that can make it harder to navigate decisions. Third, your relationship with your healthcare provider matters more than ever, because in a world with less centralized clarity, that is where decisions are going to be made. And finally, trust matters. Not blind trust, of course, but informed trust. Asking questions, seeking credible sources, having real conversations. That's how patients navigate moments like this. Public health works best when it is clear, consistent, and trusted. Right now, we are seeing cracks in that clarity. Not because the science has disappeared, but because the system around it is evolving. And when that happens, patients feel it first. So if you take one thing away from today's episode, it's this. If something feels confusing, you're not alone. But don't disengage. Lean in, ask questions, stay informed. Because these decisions affect your health, your family, and your community. If you want to go a step further, join us at the 50statenetwork.org. That's 50statenetwork.org. 50statenetwork.org. It's free, it's patient-driven, and it's how thousands of people across the country are making sure their voices are heard. Because at the end of the day, health policy isn't about headlines, it's about people. Thanks for listening to The Health Advocates. If this episode helped you understand what's happening, share it with someone who needs it. And if you have thoughts for us, leave a comment down below. We'd love to hear your perspective. To stay informed on all the policy information you need, click the button below that says subscribe. It's totally free to you and lets you stay up to date when new episodes come out each week. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.